Hey everyone, let's get right into it. If you've ever felt completely paralyzed by the fear of an unknown medical bill, well, you are in exactly the right place. In this explainer, our goal is pretty simple. We are going to transform that fear of unpredictable healthcare costs into actionable, transparent knowledge. We're going to break down the actual numbers from Mederi Urgent Care, so you know exactly what to expect before you ever even step foot inside a clinic.
Let's be honest. Do unexpected medical bills make you hesitate to get care? It's a very real, very common dilemma. When you don't have health insurance, or maybe you're dealing with a massive deductible, figuring out the cost of medical care often feels like a giant guessing game. And because of that opaque pricing, people routinely delay essential treatment, but avoiding care can lead to much bigger and ultimately way more expensive health problems down the road. It's an anxiety we completely understand, but it's also one we can totally dismantle right now.
Okay, let's dive into this. Here is our roadmap for today's explainer. Number 1, the base cost explained. 2, pricing common medical conditions. 3, the impact of location. 4, dodging sneaky hidden fees. And 5, smart ways to save.
All right, starting with Section 1, the base cost explained.
$180. Just let that sink in for a second. Without insurance, a standard urgent care visit in the USA typically runs anywhere from $125 to $300, but the average base cost sits right around $180. Honestly, that is a massive relief for a lot of people who just assume simply talking to a doctor is going to bankrupt them. This figure right here anchors your expectations. It essentially covers that initial consultation with a healthcare provider.
And understanding that base cost is absolutely vital. According to data from the Kaiser Family Foundation, uninsured adults between the ages of 18 and 64 pay out of pocket for almost 40% of their care. When nearly half of the financial burden rests entirely on your shoulders, you literally cannot afford to be in the dark about baseline pricing.
Now, if we look at the absolute lowest expected base cost, you're looking at around $100 to $125, but you kind of have to know what that actually buys you. That minimum price covers just the physical exam and a general diagnosis for minor ailments. Think a common cold, seasonal allergies, or maybe a minor rash. It does not include the whole shebang. No lab tests, no specialized procedures, and no meds. It's really just the baseline starting point.
Moving right along to Section 2, pricing common medical conditions.
So how does this build? Say you wake up with a scratchy throat. A general consult is that $100 to $250 range. But if you suspect strep throat, you're going to need a test. An infection visit, which is the consult plus a rapid strep test or a urinalysis, bumps the cost to an estimated $165 to $265. That's a very specific, totally manageable added fee. Now, what if you stumble on a hike? If you need an x-ray to rule out a fracture, or maybe stitches for a cut, the estimate jumps to somewhere between $275 and $600 or more. And simple things like a flu shot or a tetanus vaccine, that's just a flat fee of around $30 to $70.
And this brilliantly illustrates exactly where the value of urgent care shines. Even if you're paying $300 or $600 out of pocket for an x-ray or stitches at an urgent care center, it is a fraction of the cost of going to the emergency room. For similar, non-life-threatening conditions, an ER can charge you thousands of dollars due to massive overhead and facility fees. For minor injuries, urgent care is consistently the smarter financial choice, for sure.
Which brings us to Section 3, the impact of location.
According to data from BuzzRx, the exact same standard of care varies regionally. For instance, the average cost in parts of Virginia is $225, compared to $190 in Michigan. Why? Well, because local cost of living, regional labor costs, and the level of local healthcare competition all get baked right into your final bill. A clinic in a major metropolitan area in California or New York will inherently have higher overhead than a rural clinic, and that directly reflects in their self-pay rates.
But hey, it's not just the state or city you're in, it's the type of building you walk into. Independent urgent care centers generally offer highly competitive self-pay rates because of their lean administrative structures. On the flip side, urgent care centers that are affiliated with a larger hospital system often charge higher facility fees. These fees exist simply to cover the massive overhead of being part of a big hospital network. Choosing an independent center can actually be a pretty simple way to keep your costs down.
All right, onto the stuff that really drives us crazy. Section 4, dodging sneaky hidden fees. You go in for a twisted ankle, but the real pain arrives in the mail weeks later. You might see a facility fee, which is essentially a cover charge just for walking into the building. Or maybe they sent your blood work or x-ray to an off-site lab, triggering a whole separate bill from an external facility. And beware of checking in on a Sunday. That after-hours visit on an evening or weekend might cost you a premium rate. Finally, don't be shocked by itemized supply charges. Yes, things like bandages, splints, or even seemingly complementary medication samples can be itemized and charged to you separately. No way, right? But it happens all the time.
So how do we actually dodge them? We use a 3-step proactive playbook to turn passive anxiety into an active consumer strategy. Step 1. Always call upfront and ask for a detailed cash pay estimate based on your specific symptoms. Step 2. Get that estimate in writing before agreeing to extensive services. Step 3. Explicitly clarify if labs and imaging are processed in-house. Just ask, will I receive a separate bill from an external facility? Asking these questions up front puts you firmly in the driver's seat.
And finally, Section 5, Smart Ways to Save. This right here is perhaps the best-kept secret in healthcare, the prompt pay discount. Many urgent care centers offer a massive discount, often ranging from 10 to 30% off your total bill, simply for paying in full, in cash at the time of your service. You should always ask for a prompt pay or self-pay discount this second you check in at the front desk.
So the crucial point is that you have options even without insurance. If the final number still gives you sticker shock, call the billing department. They often have the power to negotiate the rate down. If you can't pay a lump sum right away, ask for an interest-free payment plan to spread it out over a few months. For ongoing, non-urgent needs, look into community health clinics which scale based on your income. If you just have a minor cold, maybe skip the clinic entirely and opt for a much cheaper telehealth virtual consultation. And finally, if you have access to a health savings account or a flexible spending account from a past job, remember you can absolutely use those pre-tax funds to pay your bill.
Ultimately, it all boils down to this. Knowing your options empowers you to seek necessary care confidently and manage your medical bills effectively. Your health is paramount. Financial uncertainty should never be the barrier that prevents you from prioritizing your well-being. Once the pricing structure is transparent, that fear disappears.
I'll leave you with this final thought. Next time you or a loved one has a minor injury, will fear of an unknown bill stop you? Or will you walk into that clinic, ask for a cash pay estimate, negotiate a prompt pay discount, and use these strategies to demand transparent care? You now have the knowledge. It's time to use it. Thanks for joining me for this explainer, and I'll catch you next time.